He was recovering from leukemia,
Mm-hmm.
and his T cell count was at 5, and he won. It was expected to get up to. He was recovering from leukemia,
Mm-hmm.
and his T cell count was at 5, and he won. It was expected to get up to 200.
Right.
Is there anything that we can do nutritionally to help speed that process along?
Yeah, so, he's got a compromised immune system, basically. We got to boost his immune system. I haven't had a lot of time to actually research that exact, how to promote the T cells. But, I've got a lot of post-cancer patients that, are survivors that, have a decreased immune system after their treatments. And there's a lot of different ways that we can stimulate this immune system. And we've gone over this, many times. But we got to talk about something that I haven't talked about in quite a while. And that is actually healing your gut, believe it or not, because too many doctors fail to actually talk about this. The gut is like the second brain, all right? And we got to heal the gut, because if you're not getting good digestion, most of us are not, our immune system can't come back to life, all right? So there's a lot of ways to heal the gut. Number one, I recommend a gluten-free paleo type of diet, number one. Preferably all organically grown fruits and vegetables, especially the dirty dozen. Then eat some fermented foods on a daily basis, all right? Sauerkraut, organic miso soup, tempeh, kefir, yogurt, goat yogurt, okay? A little buttermilk. These type of things, that Chinese cabbage. So eating fermented foods is a good thing. Taking some probiotics. Problem with probiotics, you never know which ones are good. So Fortifeye we developed our own line of probiotics, the Fortifeye probiotic bacteria. It's enteric coated. We actually added some enzymes to aid in the absorption. And I usually recommend people taking 3 probiotics a day, maybe 2 in the morning and 1 at bedtime, or vice versa. Taking some enzymes with each meal, or eating some raw organic fruits and vegetables with each meal, just a small amount. That's going to give you some of the live active enzymes. But if you're the typical American on the typical pro-inflammatory diet, you're going to the fast food restaurant, getting the triple burger, then you would take an enzyme with the meal, or 10 minutes before the meal to help break down the foods. And so it's all important about getting the microbiome. That's the digestive system working well, and then the immune system actually has a chance to recuperate very rapidly. So chewing our food, all right? Chew your food 30, 40 times. That's the macrobiotic way. And then you got to avoid things. Believe it or not, I got to talk about oats right now. Everybody thinks oats are so good for you, all right? In our paleo crunch that we have, a paleo simplified crunch, we don't have any wheat, barley, rye, corn, or oats in it. And so oats are what we call an anti-nutrient. Now, I'm not telling everybody to stay away from oatmeal, because you can eat some steel-cut oats every now and then, but don't do it every day for breakfast. It has phytate, or phytic acid, in it that actually can block the absorption of nutrients, so becoming further immune compromised. So I recommend staying away from wheat, barley, rye, oats, and corn as well, because corn has a similar activity on that. So healing our gut is very important. Vitamin D helps stimulate the immune system. Most of us have been told, are scared about the sun. Stay away from the sun. Well, a little sun is good for you. Half hour of sun a day between 10 and 2 without sunscreen. Half hour, 15 minutes front, 15 minutes back. Do not take a shower with soap afterwards, because you're going to wash away the oils that let the vitamin D absorb. So most people that are immune compromised have a very low vitamin D level. So now we heal the gut, get a little sunshine. You can take vitamin D supplements, but sometimes they don't absorb much. Well, so you got to really load up on it. And too much vitamin D causes just the opposite. It can actually cause brittle bones, and it can cause heart arrhythmias. So you got to be careful not taking super, super high dosages of this. And then the same old things. We got to have sleep, all right? Sleep is crucial, because if you don't get sleep, immune system can't recover as well. And then, things like be happy. Think positive thoughts. Don't dwell on negativity. You got to be happy. This helps release beta endorphins. Now, there's another thing that can help boost your immune system, and that's going very fast on a racetrack. All right. So once you get over 100 miles an hour, you know, your adrenaline increases beta endorphin activity, and that's the feel good hormone. So I'm not telling everybody to go out and go real fast on the interstate, but maybe take up car racing. But, Bob, I got to research a little bit more on specifically on your question, too. This last week was crazy. I don't know if you know this, but the word's getting around. I sold my home in Ocala. And
Yes.
it was a good day for me. It was a great home that I built for the family, and everybody's gone, so there was no reason for me to be in the Lange Manor anymore. So sold it. I'm going to be living in the Hampton Inn probably until I find something, because I don't want to commute back and forth from my Tampa Bay home when I'm in the villages. So I'm actively looking for a home right around the village area, you know, looking for some land so I can, you know, my dogs can have a place to roam. And if I want to twist the throttle on a motocross park, I can build my own.
There you go. Well, I'll say goodbye and say one more time, happy anniversary, Dr. Lange.
Thank you, Bob. I appreciate it.
You're welcome.
Take care.
Have a good day.
Bob's a good man. He helps me remind me of crucial dates, you know, and you can't forget things like birthdays for your wife or anniversaries. It's just bad. All right. You know, but those of you that work hard, you know, run 5 businesses and work 7 days a week, you know, sometimes you can't remember the important things. All right, 866-977-4820. Give me a call, 866-977-4820. You're listening to Ask the Doctor. Remember, Dr. Michael Tolentino is back in action at the Lange Eye Institute in the Villages, downstairs with the rest of us, not upstairs anymore. So if you're looking for a great retina specialist, an incredible surgeon is going to take a natural approach as well as a traditional approach, you can set up an appointment to see Dr. Tolentino. All right, let's go back to the phones. Steve in Bradenton, good morning.
Good morning, sir. How we doing?
I'm hanging in there. How you doing?
Oh, pretty good for a one-eyed fat man, I guess.
Yeah, but you're losing that weight.
Yeah, 62 pounds now. I'm down pretty good, down to 225. So.
There you go. You're getting skinny.
Yeah, that's what my wife told me. Don't lose any more, she said. We've talked about the Avastin injections several times, and it struck me. My question is, what does it do, and how does it work, and why does it take so long to work sometimes?
It's very technical, but in a roundabout way. An Avastin injection, you know, this was a colorectal drug originally, and Avastin has what we call anti-VEGF activity. That stands for anti-vascular endothelial growth factor. And so basically what it does, when you inject this into the eye, it goes and helps to stop these irregular blood vessels that are breaking down and bleeding and causing fluid and edema in your retina. It helps to stop that from going on. So it helps stop the irregular blood vessel growth, these little fragile blood vessels that are under your retina growing into your retina, causing edema and swelling and oftentimes visual devastation. Wasn't too long ago, we used to laser these. These are called neovascular nets. And we'd take a laser and laser these, and a lot of people listening are going, oh, yeah, I had that laser, and it wasn't good. Because the laser destroyed the retina, but we were destroying those irregular blood vessels to try to save the rest of the eye. And it wasn't a good thing for retina specialists because patients never left very happy. So it's been a godsend having these, Eylea injections, Avastin injections, Lucentis injections. These have been a godsend for macular degeneration. You know, and the key is to have a good group of doctors, a good team. You've got a good team that is taking care of you. You know, an optometrist, an ophthalmologist, a retina specialist. They can take care of you. And then obviously listening to this talk show and using nutrition to your advantage. And you've been doing that. You've, had some lifestyle changes. You've lost the weight and you've been taking the right supplements. So, you're doing everything you can. And then certainly the power of prayer. I mean, you got to think positive. A little prayer never hurt anybody. And you got to learn to deal with this. And then you always have to be prepared, Steve, and you know this, for the potential that can come down the pike. You're still a young man, okay? And so you can become vision impaired and people become totally blind. But life is not over. A lot of blind people listen to this show and they're productive and they're very successful and do a lot of things. Now, that's not going to happen to you, but you always have to, you know, like the Boy Scouts, what is that? Be prepared. What is their motto?
Yeah, be prepared.
Yep. So basically, that's how the Avastin injection works. And, you know, we have seen, Dr. Tolentino and myself and many other doctors, we have seen the power of proper nutrition, especially the Fortifeye Focus, because this is called triple carotenoid therapy, where you take lutein, zeaxanthin, mesozeaxanthin, and astaxanthin. So it's really quadruple carotenoid therapy. And so we've been using Fortifeye Focus. There's one out there called MacuHealth that's very good as well. And sometimes now patients with more advanced macular degeneration, we're using a combination of both of those. We're having patients take one Fortifeye Focus and one MacuHealth because they're getting the benefits of the lutein, the zeaxanthin, the mesozeaxanthin, and the astaxanthin. These are 4 carotenoids that work in synergy to help people with retinal problems. Now remember, there is not a miracle cure out there, and there's not a miracle pill you can take. These things work in synergy together. So it's a combination of traditional medical therapy and nutritional therapy.
Yeah, I was telling Dr. Runge, who is Dr. Snyder's partner, about the Fortifeye Focus. And he says, when you get an empty bottle, bring it in. So I brought it in, and he thanked me. He wanted to see what was in it because I guess he gave a seminar about eye vitamins or something. Mm-hmm. He wanted to see what was in it, you know. So I took him a bottle, and he thanked me for that.
Great. Yeah, so if more doctors would understand how astaxanthin crosses the blood-retinal barrier, gets into the retina, and helps reduce inflammation. You know, it's pretty amazing because we see, this is what I do all day long. I see patients with cross-sectional imaging of the retina, OCTs, where you see retinal edema. And I have certain group of patients are not going to have an injection no matter what I say. They're just not going to have a shot in their eye. So what can you do for them? So those, we can only do, you know, nutraceuticals. And I have a fairly good percentage of those patients that are improving when we put them on, you know, a combination of the things that we talk about on this program.
What do you think about that Durezol? Is it good?
Durezol is a new generation steroid that is very good if you have inflammation. I mean, Predforte is good, Durezol is good. Those two actually are very good at lowering the pressure, even better than things like Lotemax. But you got to be careful because you get a pressure spike. You can have steroid-induced glaucoma. So anytime the doctor's putting you on these steroids, they got to just monitor you carefully, because if you do have a pressure spike, then they can put you on an anti-glaucoma drop. But Durezol is a very good drug for inflammation in the eye, so it's very effective.
The doctor tells me that he does the scan and he looks in my eye and he gets the split light and all that, and he says I'm looking like I'm improving and it's really looking good, but my vision doesn't seem to be getting better. Is there a lag time between what he says and the vision getting better? Right,
there is, because when we look at a scan and we see the edema going down, so if it goes down 20%, that's great, that's improving, but it's got to go down significantly more to get some valuable, vision back. And some of these people get a lot of vision back, and some people don't get as much vision back. The key with this is to keep the swelling down. Remember, you think of it like this in layman's terms. These are blisters in your retina, all right? And those blisters, as long as they don't pop, you do pretty good. When they pop, then they cause swelling, edema, bleeding, fluid accumulation, and that's when you can have visual devastation. And so, like I said, the combination of the injectable medications, dietary adjustments, weight management, the supplements that we talk about on this, blocking the blue light, because remember, the blue light comes from your computer, your iPad, the television, the sun. That blue light is kind of like frying an egg yolk, all right? So the egg yolk is the blister, and then the blue light is kind of like the flame that can fry that egg yolk. So it's a combination of doing all these things, and quite frankly, most doctors don't even discuss any of these things with their patients.
No, they don't. I had that, he lasered me here probably 8 or 9 months ago, and he said there were some leaking capillaries, and he lasered them up Was that the wrong thing to do you think?
No, because you're diabetic as well. And so, yeah, you have to look at these leaky capillaries, and sometimes laser is the best way. So he's not lasering the macular. He's lasering the peripheral area to keep that bleeding from coming into your macula zone. So absolutely, laser in diabetics is still a mainstream treatment.
He said the fluid situation is good, and the edema has decreased. And he says should be seeing real good here coming up pretty soon. And it's just like I'm not seeing that good yet, you know. I was just wondering about that lag time.
Yep, you just got to be patient. Be patient. Rome wasn't built overnight. You know, keep the faith.
Okay, thank you so much, Doctor. I appreciate it.
All right, Steve, you take care.
You too. Bye-bye.
All right, you're listening to Ask the Doctor. I'm Dr. Michael Lang. 866-977-4820. If you got a question regarding your vision, eye care, a nutritionally related topic, 1-866-977-4820. Also, you can follow me on Twitter. Now we got about 40,000 people on Twitter following me. LinkedIn, Google+, obviously Facebook, Pinterest, Instagram. So social media is a great way to get some special codes every now and then. I'll give out one day for a discount on the Fortifeye line of vitamins. All right. Remember, the new Paleo Crunch, a new batch is in. You can get it at the Lange Institute. You can order it on Amazon. You can get it at Fortifeye.com. You can go to PaleoSimplified.com. Paleo Crunch is called Honey Nut Fruit Crunch. It's all gluten-free, all organically derived nutrients in it. It tastes really good. Your kids will like it. Your great-grandparents will like it. And it's actually good for you. None of the bad stuff, like I said. There's no oats. There's no corn. There's no wheat. There's no barley. There's no rye in it. So it's actually very good for you, and it's very tasty. It's called Honey Nut Fruit Crunch, and it is on the Lange diet. You can get the Lange diet plan. You can call Fortifeye Vitamins. We'll send it out to you. The Honey Nut Fruit Crunch now can be used as the snack in between meals. All right, Fortifeye phone number is 866-503-9746. One more time, Fortifeye Vitamin is based in Ocala now. It's right there on Southwest 17th Street next to Wood U. That's 1510 Southwest 17th Street. You can go in there and you can try any of our products. If you want to try the fish oil, if you want to try the protein, if you want to try the paleo bars or the paleo crunch, we'll open up and let you try them right there at no charge. So you can try them before you buy them. 1510 Southwest 17th Street, right next to Wood U. One more time, the phone number for Fortifeye Vitamins is 866-503-9746. All right, we're going back to the phones. Stacy in Tampa, thanks for holding.
Hey, how you doing?
Good. How you doing?
All right. So I'm 46, going on 47, and about 3 years ago, I got the dreaded I need the readers.
Yep.
I'm up to about 1.25, 1.5. Arms are not getting any longer. And so is there anything out there? I retired from the military in 2009, and right before I retired, I was trying to get it fixed before I retired. And they said there's nothing out there, and I was just wondering if things have changed, if it's covered by, I have TRICARE, if it's covered by insurance now.
Wow, so you
with
got
my job and stuff, it's really tough.
Well, you got the best insurance out there. I mean, TRICARE is phenomenal insurance. So anyway, you're at a stage called presbyopia. Presbyopia is when we hit 40, we lose the ability to focus up close, all right? It happens to everybody. We can delay it, and I actually have reversed it. I'm 55 now. I don't need reading glasses. When I was 50, I did. So there is one nutrient you can eat a lot of that will help your focusing. That's wild Alaskan salmon. And the reason wild Alaskan salmon improves focusing ability is what gives the wild salmon its red color is called astaxanthin. It's got to be wild caught. It can't be farm raised. The astaxanthin actually has been shown now in multiple clinical studies to improve accommodative ability or focusing ability. So I developed a little pill, if you listen to the show, called Fortifeye Focus. It's lutein, zeaxanthin, and 6 milligrams of astaxanthin. I started taking it it might have been 6-7 years ago now, and it took about 3 months, but my near vision is to the point where I don't need my reading glasses anymore, and I needed them from about 47 to 50. And so it has helped me significantly, and I see this every day in patients. It's not a miracle pill. It doesn't reverse it in everybody, but you're still pretty young. So it's a possibility. It would help. Eat more wild salmon. Try to take the Fortifeye Focus. Take it for 3 months. See what happens. Otherwise, reading glasses, bifocals, progressive lenses, you can go into contact lenses. We have multifocal contacts now that work great. 1-day disposable multifocal contacts. Very comfortable, safe, that allows you to see up close and in the distance. As far as surgery goes, Stacy, I would recommend staying away from any type of surgery for this condition. There are doctors that would do certain procedures, and usually it backfires, in my opinion, because we're either going to have to take away your depth perception, where we adjust one for near and one for distance, and I'd rather you do that with contact lenses because it's reversible, all right? Surgery is not reversible. So at this point, there's another way you can do it surgically, where we put a multifocal implant in. If you don't have a cataract, once again, there's an old saying, if it ain't broke, don't fix it. I don't recommend going and doing surgery and removing a perfectly normal crystalline lens in your eye if it does not have a cataract, just to eliminate the need for wearing reading glasses, because there's always that possibility of something going wrong during surgery. So at this point, I would try Fortifeye Focus, eat wild Alaskan salmon. I would consider contact lenses if you want to get rid of glasses.
All right. Well, I appreciate your help.
All right, Stacy, you have a great one. Take care.
All right, take care. All right, bye.
All right. That was a few quickies. If you got a question, pick up the phones and give me a call, 1-866-977-4820. You're listening to Ask the Doctor, 1-866-977-4820. Wondering if we're coming in loud and clear in the Sky 97.3 FM studios in Gainesville, Florida. So if we are, pick up the phones and let me know. Also, you can watch me on newstalkflorida.com. So we're live video streaming, newstalkflorida.com. All right, one more time. Phone number is 1-866-977-4820. All right, back to school. The kids are going back to school. Mackenzie starts back on Wednesday. Skycrest, she goes there. She loves that school here in Clearwater. And so back to school. You got to get your kids in for a routine eye exam. Many children get labeled as attention deficit disorder, dyslexic, hyperactive, all sorts of negative things, when all they needed was a pair of glasses. And these kids will pass school screenings all day long because they're not nearsighted. So they see in the distance. They just have trouble seeing up close. And they will not want to read up close for a long period of time, and they'll throw the book away and they'll go do something else. So they get labeled as attention deficit disorder or hyperactive, and God forbid they get put on Ritalin. Also, stop feeding your kids these colorful, sugary cereals in the morning, all right? Because that, combined with their vision problem, no wonder they're getting C's, D's, and F's and getting labeled with attention deficit disorder or hyperactivity and all sorts of other things, dyslexia. So get in for a full eye exam, adjust your children's diet. There's nothing wrong with eggs. Make them an egg omelet in the morning, or maybe make them a protein smoothie using our Fortifeye Super Protein. Put some bananas in there, maybe some A2 cow's milk and some blueberries. Add a little kale. They'll never know you put the kale in there. Blend it all together. And so alternate it. One day give them a smoothie. One day give them an omelet. One day, I don't know, if they like wild salmon, maybe a poached egg with some cheese, goat cheese, and wild salmon over a piece of gluten-free toast. So you can do a little bread every now and then, some gluten-free toast. Protein, protein, protein for breakfast. Remember, your blood sugar is the highest first thing in the morning. And then what do? We have a donut. We have orange juice, which is, concentrated sugar. We have cereal, sugary, colorful, dyed cereal, pancakes with more syrup on it. So more protein. You can have eggs. You can have chicken. You can have fish. You can have lean steak. Bacon and sausage. Not every day, though. Mix it up a little bit. So adjust your child's diet. And you might want to consider putting your child on our Fortifeye Focus little gel cap. Kids can swallow this at a very young age because it's very small, because they're getting bombarded with blue light in the classroom all day long. So blue light defense lenses in their glasses. Fortifeye Focus Pill every day for breakfast. All right, let's go back to the phone. Mary in Bradenton, good morning.
Good morning, Dr. Lange. I like to listen to you every week.
Thank you.
And I was listening about, it's interesting to learn about eyes and nutrition. I'm going to ask a question about nutrition. I'm basically a vegan, and I'm considering going back to fish oil, which seemed to help me with my depression. Eggs, controversial. I know you talk about eating eggs a lot, but this morning you mentioned goat yogurt, which I mostly eat soy or almond yogurt, and I make a nice chia pudding with it. I see that goat yogurt is pretty popular in the health food stores. What's so good about goat yogurt? And then I'm going to hang up.
Okay.
Thank you so much.
You're welcome. All right, great questions. I definitely recommend getting back on the fish oil. Fish oil is very important because vegans, true vegans, oftentimes are very deficient in omega-3. Omega-3 from a fish oil, good fish oil like Fortifeye Super Omega is the best way to do it. Victor Kovinkis is a good friend of mine. Victoris is the father of the raw food movement. I did an omega index test on him. You know, he was telling me, Michael, my omega-3 is going to be great because I eat flax seeds, I eat chia seeds, and his omega index was 1. I mean, that's non-existent. I put him on the Fortifeye Super Omega. He did take it, and it went up to about 11 in 3 weeks. So omega-3 is very important. All right, eggs, free-range, organically raised eggs are actually very good for you. In the olden days, we used to say eggs increase your cholesterol. There really is not any good studies proving that at all. But don't eat eggs every day. I mean, eat them 3 times a week. So yogurt, here's the big issue with yogurt. I would throw the soy yogurt in the trash can. Soy has some very bad things going on. Most soy is genetically modified. It can affect your hormones. I would just stay away from soy unless it's fermented. Fermented soy like miso soup or fermented tempeh, organic fermented miso soup and tempeh is actually very good for you, but once again, in moderation. So the reason most yogurts I don't like, most yogurts are coming from regular dairy cows, black and white dairy cows that have gone through a genetic mutation that takes the beta-casein protein. It's called A1 beta-casein protein. And there's a lot of good information out there, science that shows that this type of beta-casein protein causes leaky gut, irritable bowel, cancer, and diabetes. And we all know people that have all of this. And think about it. They've been drinking all this milk for years and eating the cheese and eating the yogurt thinking it's good for them. So if you're going to drink milk, A2 cow's milk or Promised Land milk, you can buy both of those at Publix. Those are from A2 cows that have not gone through that genetic mutation. The beta-casein protein is A2. It's actually good for you, not bad for you. So that's why the whole yogurt deal. I don't know of any A2 yogurt. I have not found it anywhere, and I've looked. So goat yogurt, goats have not gone through that genetic mutation, so you can drink goat's milk or you can have goat kefir or goat yogurt. Goat kefir is one of the best things in the world for the microbiome. Now, in the beginning of the show, we were talking about stimulating your immune system and by getting your gut healthier. That's one way, a fermented milk product from goats. So a goat kefir with blueberries in it. You can buy that at a lot of Whole Foods and places like that. Fresh Market has it now, I think. Publix even has some of that goat kefir. And what's that new place in Ocala? I can't think of the name of it now. It's a great place in Ocala. Farm Fair, something fair. Ooh, it's on the tip of my tongue. Oh, well, I'll think of it in a minute. Anyway, yeah, so goat kefir, very good for you. It doesn't have the bad stuff. It has the beta A2 casein protein. Hope that answers your question. All right. Another great way to stimulate your immune system is to drink a whey protein concentrate on a daily basis. So the problem with whey protein concentrates, most whey protein concentrates are coming from Chinese raised cows that are filled up with all sorts of stuff that you don't want in your system. And so you got to get something that's grass-fed, number one. That makes the lactoferrin higher, the CLA higher, the covalent bonded cysteine higher, which stimulates your immune system. So great for anybody at any age, especially people that are recovering from diseases like cancer. So a whey protein concentrate. The problem is it's hard to find a grass-fed whey protein concentrate from New Zealand cows that is unbleached and non-denatured, because most of these have been heated up over 300 degrees, and it denatures the protein molecule, and it causes it not to absorb or do the beneficial effects of this protein. So once again, I try to develop the best of the best. I've developed a product that's called Fortifeye Super Protein. We have it in vanilla, chocolate, and naked. We were on back order for naked because it was so huge a hit. All the naturalists in the country are ordering it. That is back in now. So now you can order Fortifeye Naked Protein. Also, Paleo Simplified now has naked protein as well. So Fortifeye Super Protein will stimulate glutathione, stimulate muscle stimulation, lose fat. It's on the Lange diet plan. Kids can take it. Your great-grandparents can take it. As a matter of fact, I recommend that. Instead of things like Ensure, get a good protein like Fortifeye Super Protein. Take our Fortifeye Blue-Green Superfood. Combine both in some A2 milk, all right? Or almond milk or coconut milk, but not soy milk. Shake it up really good and drink it down. That's great for anybody at any age. All right, phone lines are open, 1-866-977-4820, 1-866-977-4820. Getting a lot of calls from the News Talk 820 arena. We hit this, just about the entire state of Florida, but I'm wondering what's going on with 97.3 FM, The Sky out of Gainesville. So if you can hear me, give me a call, 1-866-977-4820. Also, I recommend going to a website, paleosimplified.com. Paleosimplified.com. Check it out. Learn about the paleo bars that we have. Learn about the paleo nut crunch, the honey nut fruit crunch. Remember, snacking is one of the things that's making America fat. So you might be eating a great breakfast, lunch, and supper, but then the things that you snack on during the day are high calories and low in nutrition. So the good thing about the paleo bars, it's all low glycemic index fruits. There's sugar in it, but there's no added sugar. This is naturally occurring sugar from the nutrients that are in it. It's relatively low carbohydrate, but since it's low glycemic index and has a good source of protein in it, it gives you prolonged energy after eating it. So I eat breakfast at 6:30 in the morning, and then I have a paleo bar and a handful of paleo crunch, usually around 10:30, and literally I can miss lunch and not eat until 7 the next evening, that evening, not the next evening, and I have no problem. So this stuff is very good. It's good for you. It works. It's great to put in your kids' lunchbox to school. It's great pre-workout, before you work out. One of the best forms of energy. That's why we call them paleo energy bars. And then post-workout, you take A2 chocolate milk, a scoop of whey protein, concentrate, Fortifeye Super Protein, and a wedge of watermelon, blend it together for 5 seconds and drink it down. So that's a post-recovery workout drink. All of this is on the Fortifeye website if you go to fortifeye.com. All right, I think we're getting ready to take a break here. So you're listening to Ask the Doctor. Get your phone lines ready. We're going to take a break, then we'll take some more calls. 866-977-4820. I'll be back in about 2.5 minutes, so stay tuned.
Doctor, my eyes cannot see the sky. Is this the price for having learned how not to cry?
Hi, I'm Dr. Michael Lange. I'm a board-certified optometric physician and a certified nutritional specialist. Did you know that the majority of vitamins that you can buy over the counter are filled with synthetic nutrients, dyes, and trans fats? All of the things that are bad for you. This is why I developed Fortifeye vitamins, an all-natural nutraceutical developed over years of clinical research. Fortifeye Complete Plus is equivalent to 10 to 12 servings of fruits and vegetables a day. This supplement is a multivitamin, I-vitamin, veggie and fruit blend with enzymes and omega-3 fish oil, developed to promote total body wellness and healthy vision. Isn't it time that you took control of your health with Fortifeye vitamins?
Take control of your health with Fortifeye. Learn more and order now at www.fortifeye.com. Available at Lange Eye Care and Associates.
All omega-3 is not created equal. Hi, I'm Dr. Michael Lange. You hear a lot of commercials that promote omega-3 products. It may be confusing. Most large studies confirming the positive health benefits of omega-3 were done with fish or fish oil. As founder of Lange Eye Care and a doctor in search of what's best for my patients, I visited Norway on a research trip to develop Fortifeye Super Omega, the highest quality omega-3 fish oil available. Only wild-caught fish with the highest omega-3 content are used in this formula. Produced in Norway at the only NSF and GMP certified omega-3 facility in the world, Fortifeye Super Omega eliminates any odor or aftertaste. It promotes heart, brain, eye, and joint health. Fortifeye Super Omega has 1,600 milligrams of triple refined omega-3 fish oil. Compare it to anything on the market. You won't find a more bioavailable form of omega-3. To purchase, go to fortifeye.com. That's FORTIFEYE.com or call 866-503-9746. That's 866-503-9746.
If you or a loved one is suffering from macular degeneration, then take note of the following information.
Hi, I'm Dr. Michael Lange. I'm a board-certified optometric physician and a certified nutritional specialist. Macular degeneration is the leading cause of blindness in patients over 55. I have personally seen thousands of patients with macular degeneration in clinical practice for over 17 years. I have seen the positive benefits that patients can realistically obtain through nutritional intervention and lifestyle modifications. I have developed a science-based nutraceutical called Fortifeye Complete Macular Defense that takes all of the latest nutritional research and incorporates it into one convenient daily packet. There is hope for macular degeneration through proper nutrition. Isn't it time that you took control of your health with Fortifeye Complete Macular Defense?
Learn more and order now at www.fortifeye.com. Available at Lange Eye Care and Associates.
Genesis Communications presents the show that's helping people see better and feel better all over Florida. It's Ask the Doctor with board-certified optometric physician, certified nutritional specialist, and popular radio host, Dr. Michael Lange of Lange Eye Care and Associates.
Doctor, my eyes cannot see the sky. Is this the price for having learned how not to cry?
Alrighty, welcome back. You're listening to Ask the Doctor, the second part. I'm Dr. Michael Lange of the Lange Eye Institute, Fortifeye Vitamins, and Paleo Simplified. If you've got a question, pick up the phones and give me a call, 1-866-977-4820, 1-866-977-4820. I want to talk briefly about a supplement I developed, the one that I take. You know, Fortifeye has a lot of nutraceuticals. Well, the one I actually take is called Fortifeye Complete. This has 60 tablets in a bottle. And these are actually, it's a nutraceutical that was developed to aid in total body wellness and vision support. And it's a combination, multivitamin, I-vitamin, superfruit vegetable extract, and enzymes, all in one USP dual delivery system tablet that I actually really developed. And so it's based on the latest science. It's been used by, thousands of people throughout the world now. And it's in its 15th reformulation. I just came out with a new formula just recently where we tweaked it again. And so we were talking about anti-VEGF nutrition and anti-VEGF injections a little while ago. So what we've done, I've taken some newly researched nutrients like resveratrol from red wine, polyphenols from green tea, curcumin from the turmeric root, and we've added that to this formula. And these nutrients actually exhibit powerful antioxidant powerful anti-inflammatory, but also they exhibit anti-VEGF activity. So in theory, that can help inhibit the formation of these bad blood vessels that actually leak. Also, there's some other nutrients that exhibit anti-VEGF activity, and that's vitamin D. We got plenty of vitamin D in here. Zeaxanthin, we got plenty of that in there. Tocotrienols, which is the good form of vitamin E. And then the super berries that we use in here, and also B vitamins. And we've got plenty of B complex in here. So once again, this formula has a very high ORAC value. We've taken some of the superfoods like green tea, goji berry, acai, mangosteen, pomegranate, blueberries, bilberries, grapeseed extract, cinnamon, cocoa. We've all added that to improve the ORAC value. But at the same time, we've taken things like acetyl L-carnitine, alpha-lipoic acid, and CoQ10 to actually support mitochondrial health and increase ATP, which is energy, along with neuroprotection. Remember, we're not using the synthetic one form of vitamin E. We're using all 8 forms of tocopherols and tocotrienols in this formula. No zinc oxide. We use a small amount of zinc monomethithione. So this is really a great formula. No vitamin A, no copper, no beta-carotene. So it's called Fortifeye Complete, all right? Advanced Nutrition. It's your multivitamin and eye vitamin. I take 2 a day. You take that along with your omega-3 fish oil and your Fortifeye Focus. I call that the triple whammy of anti-aging. Remember, you can always use LEC 20%, and I think it talks about it on the website. Anytime you buy 3 Fortifeye products, you get 20% off. So those of you out there that really want a great multivitamin, eye vitamin that has everything in it, that's on its 15th revision, think about Fortifeye Complete. It's the one that has 60 tablets in it. It works. I tell you, that's what keeps me going, along with some other things. Obviously good diet, sleep, exercise, a little sunshine, the things we talk about. All right, we're going back to the phones. Linda in St. Pete, good morning.
Good morning, everyone. Hey, my question is about glare bothering my eyes. Like, I'm a delivery driver, like during the day, and I'm just finding the glare is just bothering my eyes so bad that when I get inside a building and I try to look at my delivery ticket, I can't even really read it because it looks like all black. And so I've been listening to you for a few years now, and I've been taking note of your different formulas and all that. But what do you think would be the best thing to maybe help my eyes deal with all that glare?
All right, a few things. Number one, make sure the windshield on your vehicle is extremely clean because that's going to enhance glare. Number two, you need to have a good pair of polarized sunglasses when you're driving. All right, because what happens is that light comes in and it actually bleaches the cones, and then it causes you to have a lot of problems when you go indoors and when you're looking at your tickets and things.
Right.
So a good pair of sunglasses. If you're going to buy over-the-counter sunglasses, Maui Jim makes the best one on the market. It blocks the blue light and the UV light. So get a good pair of polarized sunglasses. If you need the prescription, have your local optical put the prescription in it. So clean the windshield, good pair of polarized sunglasses. Use some lubricating eye drops. The ones I like the best are Oasis Tears Plus or Blink Tears preservative-free Blink Tears. And what you want to do is put a drop of that in periodically while you're driving, because when you're driving, your blink reflex is diminished, so you're not blinking because you're concentrating, and therefore your eyes dry out. When your eyes dry out, glare becomes more of a burden, all right? And then lastly, the little pill I talk about that sounds like a miracle pill for everything, but Fortifeye Focus. It really helps with glare. It helps with reaction time. It helps with night vision. It helps with the dazzle effect from those cars' headlights that can be blinding.
I have that too. I'm
using the Fortifeye Focus, and now since I've been racing cars, I've got a lot of professional race car drivers using it now, and they're all claiming it's improving reaction time and acuity and contrast. So I would definitely take Fortifeye Focus or something similar to Fortifeye Focus. It's got to have lutein, zeaxanthin, and astaxanthin in it in the same ratio that we have in the Fortifeye Focus. So I try all those things. And then obviously the other thing is if you haven't seen your eye doctor recently, go in to see your local optometrist or ophthalmologist, get a good eye exam, make sure there's not other things that could be potentially causing the glare, things like corneal problems, cataracts, retinal issues. You might have a little prescription where you have a little astigmatism or something that's creating it. So that's a good rule of thumb. Get in, have a comprehensive eye exam as well.
How much do you think that would cost, like at an ophthalmologist?
Well, it depends. A lot of people have insurance. I mean, if you're driving, you might have a vision plan, okay? So,
well, no, basically now I have nothing.
Nothing?
So,
okay.
Yeah.
Well, we charge cash pay is $100 basically for a comprehensive eye examination. That's dilation, retinal evaluation, refraction, everything. And some doctors, some places will charge less and some places will charge more. But I would say, an eye exam is probably between $75 and $150, just depending on where you go.
Oh, okay. And then what was the name of the sunglasses that you mentioned?
Maui Jim.
Oh, Maui Jim.
Yeah, so Maui Jim, Costa Del Mar makes some good ones too, but Maui Jim, every Maui Jim lens now has blue filtering lens in it. So that's why I like them the best, because I know the company. I know the president of the company. It's good quality. Stand behind their products. Amazing warranty.
Oh, good. Because, I just feel like every day I'm just burning my eyes out more and more. You know what I mean?
Yep. So do those things we talked about, and then keep me posted, Linda. Give me an update, okay?
I will, but just one other quick question. Of all you mentioned Fortifeye Macular Defense, Fortifeye Complete, and Fortifeye Focus. Of those three, which one do you think might be the best for me with my situation?
Fortifeye
and also,
Focus. Yeah, Fortifeye Focus, definitely.
Focus?
Yeah.
Okay.
Now you could always add, to get a little more antioxidant protection, you could add Fortifeye Once Daily. That's kind of a multivitamin eye vitamin. So you could take the Fortifeye Once Daily and the Fortifeye Focus, then make sure you eat fish frequently. If you're not eating fish, then take a good omega-3, a triglyceride form, like the Fortifeye Super Omega. Remember, I call that the triple whammy of anti-aging. Omega-3, Focus, and either the Once Daily or the Complete. And you should be fine. But the Focus, if you only took one for you, from just what I'm hearing, Fortifeye Focus. Okay.
Oh, wow.
All right,
I'm
Linda.
going to order it. I hope it helps. And, and the readers, another one of your callers mentioned the readers. I'm up to like 3.25. I think that's the strongest.
Yeah, the Fortifeye Focus will help cut back on that power. Definitely.
Oh, okay.
So it will help, but not instantly. Remember, Rome wasn't built overnight. Give it a couple of months, 2 to 3 months, to fully get cellular absorption.
Okay. All right.
All right, Linda.
Well, I'm going to order these things, and thank you so much for all you do.
Take care. Bye-bye.
Okay, bye.
All right, so you can order it at Fortifeye.com. That's Fortifeye, Fortifeye.com. Or you can call Fortifeye Vitamins Monday through Friday, 866-503-9746. That's 866-503-9746. All right, let's go back to the phones. Paul in Gainesville, good morning.
Hey, good morning. Thanks for taking my call.
My pleasure.
Hey, just real quick, you were talking about breakfast earlier, and I grew up on cereal, and I know it's not the best thing for me. However, I still love it. I've switched my milk now to the A2 milk, and it made a huge difference. I can feel the difference. I don't feel bloated at all. It feels great. But is there a cereal I can eat that is healthy so that I don't feel guilty every time I have a bowl of cereal?
Well, Paleo Simplified has one. It's called Honey Nut Fruit Crunch. So you can go to their website, Honey Nut Fruit Crunch, but Paleo Simplified. It's totally gluten-free, all organic, non-GMO. It doesn't have any of the bad stuff, the anti-nutrients from oats. It doesn't have wheat. It doesn't have barley. And it tastes delicious. And you can put some A2 cow's milk on it, and you can put some blueberries in it if you wanted. But it already has the fruit in it, so it's made to be a complete meal.
Right.
But Honey Nut Fruit Crunch, go to the website, Paleo Simplified, or at least see the nutrient profile and then see if you can find something like that. Whole Foods in Gainesville, Fresh Market in Gainesville does not carry it yet, but soon we're hoping that Earth Fare in Ocala is going to be carrying it. But you can always order it on Amazon. You can order it, at Fortifeye.com or PaleoSimplified.com.
Okay, great. I think there's an Earth Fair here in Gainesville as well.
Yep,
so.
yep. All right, Paul.
Very cool.
Take care.
All right, thanks a lot.
Bye-bye. All right, I'm out of here. Have a great day. God bless you.
For having learned how not to cry.